Hello, I am Professor Ligia Rusu from University of Craiova, and we are partner of a project, Erasmus Plus project, named Clinical K for Electrical Stimulation in Physiotherapy and Rehabilitation. The first module of this course is Pathophysiology of the muscles. My role is to explain which is the problems regarding pathophysiology of the muscles. In this term, you have to understand first what means the muscle atrophy, because this is the most frequently aspect in pathophysiology of muscles. The muscle atrophy refers to the breaking down of muscle fibers, and it is described as occurring in skeletal muscle. The muscle atrophy has three mechanisms of produce, means physiologic mechanism, pathologic mechanism, and neurogenic mechanism. While some forms can be reversed, others cannot, and this is the aim of rehabilitation program to reduce the evolution of muscular atrophy and to increase the muscle mass. Depending on the condition, the evolution muscle atrophy could be different and also the symptoms, but usually is reduced muscle mass. Many physical or pathological stimuli could generate a lot of muscle tissue change, fiber content, capillary distribution, and the components of intracellular connective tissue. The effects are increase the pathology mechanisms that support development of atrophy or hypertrophy. One of the therapeutic interventions is neuromuscular electrical stimulation, which is a kind of electrical stimulation based on the using of device that send electrical stimulation to nerves and generate the muscle contraction. This kind of intervention does not require any muscle strength because this is a passive mechanism to stimulate the muscle contraction. Which is the management and treatment of the muscle atrophy? Treatment for muscle atrophy depends on the type and depends on the etiology. Disease, physiologic, generated by sedentary aspect in the most cases, can be treated with regular exercise and better nutrition. For this reason, the healthcare needs to make a very good assessment and after decide, depend on the etiology, what kind of physical therapy is needed and what kind of exercise is needed for restore the muscle mass. Even if you can't actively move certain joints in your body, you can do still exercise wearing a splint or brace. Also, again, the healthcare provider may have you work with dietitian health eating plan. They may suggest nutritional supplements as well. Of course, the muscle mass is connected with muscle composition. Let's see some few ideas about the muscle composition. Muscle composition, including in muscle mass is the quality and composition are important factors that contribute to overall muscle function. However, these factors can be negatively impacted by conditions such as atrophy and sarcopenia. Atrophy refers to a decrease in muscle mass, and of course, this generates change in muscle composition. Example like reduce the muscle fiber size, while sarcopenia is characterized by a loss of both muscle mass and quality that typically occur with aging. So this is two different ways that reduce the muscle mass based on change the muscle composition. Changes the composition of this tissue can lead to alteration in muscle function and performance. For instance, an increase in connective tissue could generate reduced muscle elasticity and contractile force, while a decrease in density can impair muscle metabolism and endurance. Muscle atrophy during age, of course, is particularly aspect that it's visible together with aging process. Sometimes it's very fast, sometimes it's a long duration for installed muscle atrophy. The fiber affected by this is type 1 muscle fibers, which are used for endurance activities, are less affected by aging. However, even the type 1 fibers show some decline in size and number with age. Sarcopenia. It's the name of the term used for reduce the muscle mass in aging process. And it is describe the loss of muscle mass and strength that occurs with aging. This is a natural part of aging process, but the problem is that this leads to alteration the functional activity, generate functional decline, and increase the risk of falls, the risk of fractures, especially in older adults. For this reason, the muscle mass atrophy present in sarcopenia, which is specific for aging process, need a very good and very complex assessment of the origin of muscle atrophy. And of course, the management is based on very early intervention. Another aspect that we can see in this case is cachexia. On the other hand, refers to the loss of muscle mass and weight that occurs in the context of an underlying illness such as cancer or heart failure. So cachexia it's not present just because the nutrition status decrease in voluntary process, but it is specific for chronic illness like cancer or any other systemic chronic illness. While sarcopenia and cachexia share some similarities, they are distinct conditions with different causes and clinical implications. Therefore, interventions such as exercise and proper nutrition are important to maintain muscle mass and function in aging individuals. How I said before, it's important to make the measurement, to make the evaluation of muscle atrophy for evaluate the functional impact of muscle atrophy, the status of upper limb or lower limb segment, the status of muscle tonus, the movements and balance, coordination, all aspects that means functional. For make the analysis of muscle atrophy and make the assessment, one of the important way is ultrasound. Ultrasound is a non-invasive imaging technique that uses high-frequency sound waves to produce images of internal structures. Of course, other imaging techniques such computer tomography or MRI may also be used to assess muscle structure, but they are more expensive and may expose the patient to ionizing radiation. So, in the first step of make the assessment of muscle atrophy, I consider that the main way is to use ultrasound and to monitoring the muscle atrophy using this kind of investigation. Also, another possibility is the multi-point Dixon fat mapping MRI technique. Is a promising technique that can be used to accurately quantify fatty degeneration in various musculoskeletal disorders, including more specific lumbar disc pathology. The TCA measurement by means of MRI cross-sectional area has been found to be highly correlated to the clinical measure of muscle strength. So we found a lot of studies that make the correlation between muscle strength assessed by dynamometry or scale 0 to 5 and cross-sectional area that could be measured, of course, by ultrasound, but more accuracy by MRI. This correlation can be explained because the muscle strength is largely determined by muscle size and cross-sectional area is in connection with muscle size. Therefore, change in muscle cross-sectional area can be used to evaluate the muscle strength over time. Physical exercise for muscle atrophy. How we said before, physical exercise is a part of treatment in muscle atrophy, but of course it depends on the etiology of muscle atrophy, the muscle composition, the muscle status, the nutrition status of the patient, and of course the pathogeny. Anyway, exercise has been shown to have a positive effect on muscle mass and function, especially in older adults. For this, we can speak about resistance training in particular has been found to be effective in stimulating muscle protein synthesis and promoting muscle growth. In addition to resistance training, aerobic exercise has been shown to improve cardiovascular health, but also overall fitness. And how we know fitness means cardiorespiratory, means muscle composition, means muscle strength and muscle endurance, means balance and coordination, means flexibility. So, the physical exercise can improve all components of fitness. The recommended amount of exercise for adults is at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week, along with muscle strength activity at least 2 days per week. It is recommended to consult the healthcare professional or specialist in fitness to determine the most appropriate exercise program for each individual. So, what I want to underline is that physical exercise has to be applied in accordance with the recommendation of the physician or physiotherapist. But which are reverse of atrophy in lower motor neurodenervation? Therefore, developing effective treatment and prevention strategies for skeletal muscle atrophy is important for maintain overall health and quality of life. Rehabilitation programs that include exercise and physical therapy can help to mitigate the effects of muscle wasting and improve muscle strength and function in individuals with spinal cord injury. This is aspects for the neurogenic muscle atrophy. Therefore, it is essential to preserve the muscle-nerve connection and prevent denervation to maintain muscle function and prevent muscle wasting in individuals with problems at nervous system. What about spasticity? how we know spasticity is more present in neurologic problems, even in central, even in peripheral neurologic pathology. Spasticity is developed based on stretch reflex disorders. Stretch reflex refers to proprioceptive reflexes, which are tonic, and included sustained stretch as in clonus and short stretch as in deep tendon reflex. The spasticity physiopathology has two mechanisms. One of these refers to change in the function of spinal neurons, and the second are the cerebral mechanisms encompassing supraspinal and suprasegmental mechanisms. Contractors. Contractor is different from spasticity. He has not neurologic reflex mechanism. The periarticular connective tissue restriction involve muscle, tendons, ligaments, and joint capsule. And all of these can generate contracture in most of the situations, but also could be as a result of prolonged immobility of the limb and or a lack of weight bearing in the lower limbs. The remaining sarcomers adapt to their shortened resting position and overlap optimally to potentiate maximal tension and the immobilized length. The following step from immobility to contracture formation is quantitative and qualitative change in the intramuscular connective tissue. For this reason, if we have not a very good assessment and a very good possibility to make the difference between contracture, between spasticity and aspects of different situations that generate increase of muscle tonus, it is very important to have an early intervention for reduce this mechanism that seems to be by double sense. And here are the references. What messages we can take home from this presentation? First of all, is need to make the functional assessment of the people that have muscle problems, even if we are atrophy, spasticity, or contractures. What is it important? It is important to make the functional evaluation during orthostatic, during gait, during up and down, and different daily activities. After we decide what level of functional the patient has, we can go on to make the assessment of muscle force, muscle tonus, and to decide and describe the etiology of the muscle disorders. Also, we have to make the difference between different kind of etiology in the case of spasticity. For example, the spasticity in pyramidal syndrome, neuromotor central syndrome, or extrapyramidal syndrome, because the spasticity is very different in case of two types of disorders. In the same time, after we make this difference, we have to decide if are or not a contractors. But usually contractors are developed after traumatic problems, after immobilization, after different posture of the segment of upper or lower limb. Okay, we decide what kind of problem is with the muscle. It is important to make, if it is possible, to make the analysis of muscle composition, muscle distribution to different segments of the body, using the muscle composition and muscle analysis, make the measurement, make the analysis of the muscle force, and to see what kind of goals we have to establish for the recovery, the muscle mass, to reduce the spasticity or to reduce the contractures. Anyway, in our case, we have two options. We have option 2, electrical stimulation, which is the aim of these courses, but also the physical exercise that has to be improve the muscle mass, and that has to be applied by the professional healthcare like physiotherapists. I am at the end of my presentation. I suggest you some reference that help you to make deeper in the knowledges about the muscle pathophysiology. Thank you for your attention.